Royals like Queen Elizabeth I, Henry VIII, and King Edward IV have acquired something of a bad reputation when it comes to hygiene. Filthy residences forced these monarchs to move out of their courts because of how stinky they'd become. Obviously, they had significantly different standards than we do now. The average life expectancy in the Middle Ages was below 30 years. This was the time of the plague, and a lack of hygiene had definitely played a role. Monarchs of the past maintained some truly bizarre hygiene practices. For the past centuries, Europe and its colonies was the most dirty and unhygiene as it ever been throughout history. Not only did peasants avoid cleaning themselves, but also royals would avoid water and clean themselves in ways we'd call disgusting today. Hi, welcome back to History Rediscovered. Remember to support our channel, please subscribe. In this episode, we discuss how hygiene was really like for royals throughout history. Queen Elizabeth I allegedly bathed once a month. Elizabeth I was Queen of England and Ireland from November 17, 1558 until her death in 1603. Sometimes referred to as the Virgin Queen, Elizabeth was the last of the 5 monarchs of the House of Tudor. Despite being a successful monarch, Elizabeth's hygiene practices were questionable. Queen Elizabeth I is believed to have been concerned about her hygiene and allegedly said, "I take a bath once a month whether I need it or not." Baths were not considered necessary or even particularly healthy in those days. Opening the pores to dangerous miasmas to immerse one's body in hot water was considered physically draining and not to be indulged in. Over time, physicians came to believe that washing was so dangerous, indeed, that many people consulted their astrologers to find the most favorable time to take a bath. Most physicians recommended cold water and a rough cloth for washing. Some went as far as recommending no water at all, just buffing the skin with a dry cloth was enough. However, Elizabeth was more the exception rather than the norm. Because it was uncommon for royals to bath every day, Queen Elizabeth relied heavily on sweet-smelling perfumes. In fact, she was known to have a sensitive nose and would sometimes expel stinky people from her presence by saying the words, "Fa, thy boots stink." She also carried a pomander filled with perfume to hold to her nose when something smelly was in her presence. In the Tudor era, it was believed that bad smells carried diseases, and so anything or anyone coming into the royal presence had to be sweet-smelling. The Queen was fond of sweets, but not so fond of the dentists. Moreover, they didn't even exist in the Middle Ages. According to the timeline provided by the American Dental Association, you would have to visit a barber who would just pull the teeth out. Her teeth rotted badly such that they turned black and gave off a stinky odor. In the end, Elizabeth lost most of her teeth. Many people found it almost impossible to understand her when she spoke. Elizabeth used makeup consisting of nasty, dangerous chemicals that you most definitely would not want to put on your face today unless of course you don't care about your face. The makeup was made with vinegar and white lead sourced from Venice that gave women an incredibly pale look. She wore tons of layers of makeup to hide the scars of her fatal smallpox illness that destroyed her face in 1562 when she was 39 years old. But little did she know, her efforts to hide the damage may well have shaved a few years off her life. Priests would tell women not to wear makeup because vanity was a sin. However, if a woman was sick and dying, wearing makeup to mask her illness was acceptable. Queen Elizabeth I would not wash her face. Instead, she piled new layers of ceruse lead over the previous layers as soon as she woke up. In her youth, Elizabeth used little makeup, but after her battle with smallpox, she began to wear more makeup, creating what we think of today as her iconic look. Over time, the Venetian ceruse caused hair loss and skin shedding, 2 things Elizabeth struggled with as she got older. She was in severe depression towards the end of her life. She even refused to have a mirror in any of her rooms. King James I of Scotland had lice and supposedly never bathed at all. James I was born in 1566 in Edinburgh. He was one of the few monarchs who actually managed to rule 2 nations. He made history as King of Scotland, James VI, from 1567 to 1625 and King of England from 1603 to 1625. The king had a great aversion to water, which led to a lack of hygiene, and reportedly never bathed. He went as far as not even washing his hands, but of course he made an exception only for his fingers at the dinner table after eating. He rubbed their tips with a slightly damp napkin. His lover, the Duke of Buckingham, wrote in one letter to the king saying, "So, craving your blessing, I kiss your dirty hands." A court lady once complained that she and her friends got lousy, infested with lice, by sitting in a counselor's chamber that James frequented. Historical accounts say that the rooms he spent most of his time in became infested with lice as a result of his presence. King James went months at a time without changing his clothes. He even slept in them. Back then, people only had at least 4 outfits, one for each season of the year. He did not have a masculine attitude, did not care about his appearance, he walked around like he was neglected, did not care about the elegance of his speech, and was said to have salivated profusely. Henry VIII had groom of stool, whose job included wiping the king's bottom. Henry VIII was King of England from April 22, 1509 until his death in 1547. He is best known for his tragic 6 marriages. King Henry was one of few royals who preferred to wash frequently despite medical advice. During his reign, the royal physician Thomas Vicary recommended that all the men in the kingdom have their battle wounds washed with urine. Other doctors recommended it as a treatment for the bubonic plague. Even in modern times, you may have heard of peeing on someone's leg or foot if they have been stung by a jellyfish. Upon further research, this is medically false and only adds insult to injury. Henry himself would sleep in a bed surrounded by thick animal furs. This was to prevent the palace's rampant vermin from making their way to him while he slept. He also had his own private stool seat, basically commode for portable toilet. Though we're unsure how that one was cleaned, he was still enjoying way better, more hygienic conditions on his seat than rest of his subjects. Henry VIII had groom of stool, whose job historians say included wiping the king's bottom. Toilet paper was not yet invented at those times though, so historians believe people used whatever was available or used pieces of cloth and washed after usage. As for his clothes, the king had his own laundresses, as did his wife and his children, who used soap. His garments were bleached with Tudor times bleach urine. When they would become discolored, he obviously bought new ones. It is, however, hard to determine how much of his clothing was sent to being washed and how often it was done. Henry had a small apothecary where he would mix up tinctures, salves, and potions to cure a variety of diseases. A book containing over 100 of Henry's recipes for the treatment of various illnesses is in the British Library. These probably did not work, and some contained ingredients that are highly poisonous, such as ground pearls. Marie Antoinette is said to have bathed once a month, while Louis XIV is rumored only to have bathed twice in his life, in the late 15th century. Queen Isabella of Spain bragged that she had only bathed twice in her whole life. It's impossible to predict just how many royals and noblemen died as a result of the ungodly conditions they were living in. It wasn't until the 19th century that infrastructure improved and understanding of hygiene and disease finally moved out of the Middle Ages.